Today we are going to discuss tuning fork tests. There are three main tests. Number one is Reine's test. Number two is Weber test. And number three is ABC test. These tests are done to assess the hearing loss. There are two types of hearing loss: conductive hearing loss and sensorineural hearing loss, SN hearing loss, and conductive hearing loss. These tuning fork tests are performed to differentiate between sensorineural hearing loss and conductive hearing loss. Now we will discuss the Reine's test in detail. In Reine's tests, you will take the tuning fork and strike it on your elbow here, and then you will put it near your ear here. This is step number one. You will take tuning fork, strike it on your elbow, and then you will put it near your ear, and then you will again strike it on your elbow, and now you will put the tuning fork on the mastoid. Let's see, this is the mastoid process. And now you will put the back, this side of tuning fork, not this side. You will put this side of tuning fork on the mastoid process, here. And now this is step number two. First you will put near your ear, and then you will put it on the mastoid process. Now you will ask your patient that which sound is louder. You will ask your patient which sound is louder. If he says the sound was louder when you perform this step, then you put the tuning fork near his ear. Means this time air conduction is greater than bone conduction. While performing this step, you are actually checking the air conduction. In step 2, when you put the tuning fork on the mastoid process, you are actually checking the bone conduction, because you have put the tuning fork on the bone, mastoid process. Now, if the patient says that the sound was louder, then you put the tuning fork on his mastoid. This means the bone conduction is greater than the air conduction. In Reine's test, we will get these two situations. Either air conduction is greater than the bone conduction, or bone conduction is greater than the air conduction. If air conduction is greater than bone conduction, there are two possibilities. Either it is normal, means there is no hearing loss, or there is sensorineural hearing loss. But if there is bone conduction is greater than the air conduction, then there is conductive hearing loss. You should also remember that when air conduction is greater than the bone conduction, then Reine's test is positive. And if bone conduction is greater than the air conduction, Reine's test is negative. Reine's test will be negative only in conductive hearing loss, and Reine's test will be positive either in normal hearing or in sensory neural hearing loss. Now, in order to differentiate between these two, normal and sensory hearing loss, we will perform the Weber's test, and to verify conductive hearing loss, we will perform the Weber test. This test, Weber test, is a second test, not the first test in tuning fork test. Now, in Weber test, what will you do? Weber's tests. You will take the tuning fork and strike it on your elbow, and after striking, you will put on the tuning fork here. In the middle of forehead, middle of the forehead. This is the nose. Here are the eyes. Here lips. You will put the tuning fork in the middle of forehead. Now, what will you ask the patient? You will ask the patient that in which ear he is hearing the sound which louder. If he says that he is hearing equally in both ears, then means Weber's test showing that the patient is normal. Normal when sound is equal in both ears. But if the patient says he is hearing more sound in the poor ear, hearing more sound in poor ear, more sound, this means that it is lateralized towards the poor ear. This situation when he is hearing more in the poor ear, this will be in conductive hearing loss. Conductive hearing loss. If he says that he is hearing in better ear, hearing in better ear means sound is lateralized toward better ear. This situation will be in sensory neural hearing loss. Now, I will recap this. See that if Weber's test is normal, then you will see that patient will say that he is hearing equally in both ears. And now, first of all, I will tell you that poor ear and better ear. What is meant by poor ear and what is meant by better ear? If the patient says that he is hearing low in right ear, means the right ear is poor while the left ear is better. You just have to compare it. If the complaint is in left ear, then left ear will be the poor ear, and if the complaint is right ear, then the right ear is the poor ear. Now, if the sound is lateralized towards the better ear, then it will be the sensory neural hearing loss, and if it is lateralized towards the poor ear, it will be the conductive hearing loss. Now, I will recap this. First of all, you will perform Reine's test and see that air conduction is greater than the bone conduction, then it is either normal or it is sensory neural hearing loss. And then you perform the Weber's test. In Weber's test, if the sound is lateralized toward the better ear, then it is confirmed that patient is suffering from sensory neural hearing loss. And if it is towards the poor ear, then it is conductive hearing loss. Now, what is ABC test? ABC test, you will see the bone conduction of examiner and the patient, and you will see that the bone conduction is either greater or low. In the reference value, what is the reference value in ABC test? In ABC test, reference value will be of examiners consuming